Welcome to Wellness Wednesday. I'm Deborah,
And I'm Rachel.
and we have a special guest today. It is Regina. She is our social worker. We're so happy to have her full time. So Regina, we're going to go back and a little recap real quick. Did you make a New Year's resolution?
No.
Okay, well that's easy enough. Well,
Do you ever make New Year's resolutions?
Sometimes, but not this year.
Not this
I'm not
year.
gonna stick with it, so I no sense in doing it.
Well, that's okay. That's okay. You got your Christmas down, I guess.
Yeah.
Okay. All right. Well, did you have a good Christmas?
I did.
All right. Not going to divulge any of the good stuff you got.
Um, some shoes, purse, some clothes, little cash.
That is good stuff.
I like the cash part. Yeah, that's good. So you are a social worker here, and you help us with hospice and home health, and a little bit of everything. So, kind of tell us what you do when you go into a home and to help out people when they're in need of something.
Well, initially when you go out as a social worker, we're already looking at different things. So our tenants are up. We're looking at I look out at the outside of the house once I'm inside, the demeanor of the patient, kind of doing like a mental wellness check. Does the patient look healthy? Are they safe? Bruises? Asking questions. Do you have any food? Do you have lights? Do you have water? Looking around, seeing if the house is cluttered, if it's clean, any pests. Checking out the family members that are there, asking questions, seeing how they're responding, how they're reacting to my visit. So kind of like doing like a mental assessment, taking notes mentally wise, and then just asking those, hard questions,
So how do they take it when you're asking all these questions? Do they feel like you're invading their privacy, or do they're open to it? And if they are, how do you get them not to be?
Well, mostly when they know I'm a social worker, they pretty much open up. Because for some strange reason, they think social workers can do everything.
Y'all saved the day. Let's be
Well,
real.
we
Let's be
kinda do.
real. You do.
So they're normally glad to see me, and then it's, I need this, and
They
this.
give you a list.
Yeah.
You're the magic
Yeah.
person that's going to make it all
I
happen.
need, pet services. I need to move. It's all kind of stuff.
You're like making the list.
Yeah. So normally they are open. Now, one thing they're not really open about is talking about their money.
Oh no. Yeah,
Old people ain't
yeah.
trying to talk about their money because I'm just saying.
Well, it's that generation is so private. I mean, I dealt with it with my parents, and I had to pick my day, choose my words, and go with whatever they told me. So I understand that completely. But so when you're going in a home and you see that they can't really take care of themselves any longer, and the caregiver is just totally, it's gotten above them, and we all know that can happen pretty quick. So you go out into the community, the resources, and look at long-term care. You look at assisted living or some type of way of getting them help. And how are they with the long-term care?
Well, initially before all of that, I always ask the family, what are their goals? What do they need help with? Then present the options.
Gotcha.
Because a lot of times when you're going in trying to tell families, what they need to do,
It's
that's
just
when
defense mechanism goes in.
So as a social worker, I'm in here to be a resource. I'm in here to try to help
Advocate.
advocate and navigate through the system as to what services that may be beneficial to you and your family member. So just trying to find out exactly what they need and then presenting them with those resources. And then if they need help, then I'm always there to help them.
Just as with that. Okay. Well, that's a great avenue that is very much needed, especially, I came out of long-term care, home health and hospice, and then back into home health and hospice. And there's a great need to help people in the community with finding different resources, from food banks to, different living situations. Helping them with their electricity, water, gas, food, whatever the case may be. So Regina is a great resource for us here at Retreat. She's just a phone call away.
What would you say is your biggest issue that you see when you go into a home? Like the most common, biggest thing that you see?
We're asking some tough questions. She's trying to think about this.
Well, one of the, I would say they don't know about the resources that are out there. That is one of the biggest things that I find families do not know. I'm like, oh, I didn't know anything about that. And so when I get to tell them all this different stuff, I was like, well, where is that? And I'm like, it's here in Texarkana. I think it's more educating families about the resources, the services, and also with our elderly patients, a lot of times they don't have family, so they rely on us.
That is true.
And so being able to give them those resources and having people to follow through. That's one of the problems that they have. They're like, well, I called them. They never called me back. I never heard back from them.
Trust becomes a big factor because if you let them down once, they're like, you're not going to do it again. So, and I get that. I mean, the older I get, the more I'm like, oh, you said you're going to do that. Let's do it.
Well, you get used to so many people saying they can do the things, and then they just don't ever follow back up with it.
Right.
So, yeah.
So what are some, I know you've got something in your back pocket. You're going to do something this morning. She always does.
It's still early in the morning. We bounce back and forth from morning time to afternoon with these, and we wanted to catch her today. So when you talked about New Year's resolutions, I do podcasts in the morning, like when I'm on my way to work. And so to make a New Year's resolution stick and to be able to do it, they said never call it a New Year's resolution. Call it a goal, a new goal. So roll with your goal and work on your goal daily.
Do you know today is the day that most people stop doing their New Year's resolution?
It sure is. I did see
this
that
is the
morning.
day, and I was like,
well,
well, good, because I never started it. So I'm have to.
Today is the 10th, and
they say they make it to the 10th, and then after that they stop doing it.
Yeah.
So,
So I did in the podcast this morning. It was the same one I listened to yesterday. He was like, "Well, who else has dropped their New Year's resolution?" So yeah. And I haven't dropped mine, but I have changed mine. I'm like regrouping.
It's evolving.
Yep, I am regrouping. Right now, I'm currently working on skincare. That's my thing.
I'm doing a healthier me.
Yeah.
So I went and saw. I'm old enough to be a patient at Andrea Heflin's office. I say that with pride. You got to carry that badge. So I have never had an EKG before, and I was like, okay, but it turned out okay. So, she was just covering everything. I'm like, wow, okay. I guess I've reached that age. I need one of those. And then, she talked to me about all the other stuff, and she's got me set up on all that. She did ask me if I was going to do the lovely
colonoscopy.
Oh,
yes. And
I've had one of those.
I said no.
You need to. You
no.
don't even feel it. You're asleep.
No, it's the prep that I'm not doing. But
I have did mine, and that was.
It still is.
Yeah.
No. She, but they're mailing me a box, and I'm gonna do it at home and send it to them. So there is that option. I didn't know it was out there. She said everybody in her office does it. They don't want to do.
Well, and the little commercial with the little boo boo.
And
the colon guard.
You send it to. I'm gonna do that.
Yeah,
I'm gonna do that.
Gotcha.
So yeah, I'm. That's as close as I'm gonna get to doing that.
Well, and doing that is being proactive.
It is true.
Because
it is true.
A lot of times when we see people, when we finally get to somebody,
it's too late.
They didn't do all those things. So, and I'm one of those people that I go back and forth of, do I really want to know or do I want to know?
Nope.
But I'm also the same person that will let things go for 2 or 3 weeks. And in that 2 or 3 weeks, as it's progressively getting worse, I'm Googling. So,
you make yourself worse.
Yeah, last year in December, the entire month of December, I had a headache, a terrible headache. I was taking ibuprofen every day, BC powder. I was coming to work, but I was eating all these things trying to make my headache go away. And by the time I got home, I was like done for the day. All I could do was come home and sit down on the couch. And I'm like, maybe it's just the season. But Christmas time is my season. So I'm like, maybe it's because it's getting darker. And, well, about the second week into it, I'm like, something's wrong with me.
You self-diagnosed yourself? Let me guess.
Dr. Google. I have pulled out Dr. Google, and I'm Googling where my head hurts. So I'm going through checking off. Yes, I have this.
By the time you're terminal.
Yes, I was, because the first week that I did all that, I was like, okay, you have a brain tumor. You have a brain tumor. That's what's wrong with you.
Yeah.
So then my mood dramatically changes. On top of having a headache. And the next week, the headache is still there, but I'm like, okay, well, I'm not dizzy. When I look at certain places, I still have eyesight. I hit my head 3 weeks ago on the corner of my TV when I was cleaning underneath it. You have a concussion.
Wow.
So
Dr. Google.
then I was wearing sunglasses all the time, keeping the lights down, changing up the headache medicine.
So now you're a vampire.
And we have now rolled into the third week of
Lord.
a major headache. And I went back and forth. Is it migraines? Like, if it was a concussion, it should have already been better by now. I ended up on meningitis. That was the next thing.
Ooh, you
and
went-
I
you-
cannot
you
even
did the
tell
full
you, I'm
circle.
being 100% serious when I tell you I had convinced myself that I had meningitis, and within the next few weeks I was going to start getting confused, and I needed people to know. So
This is why.
one morning we were sitting in the conference room having a meeting, and when it was over, I turned to my friend she's an RN, and she's like, are you okay? And I said, no, I'm pretty sure I have spinal meningitis. And she's like, what? And I'm like, I'm sure I have meningitis. And she said, why do you think you have meningitis? So I started telling her
Dr. Google.
this whole headache situation for the past 3 weeks now. And she's like, you don't have meningitis, but let's check your blood pressure. Let's start with that. Maybe let's just
Oh.
see. So, it was bad. Like, it was stroke level bad. And I had been rolling that way for, I don't know.
You'd really
how
been going long.
Uh-huh.
But, Dr. Google got you to that point, I guess. So I guess it was good that you
After
turned
I
your
had,
head and asked
after
the
I
question.
had a tumor
Think
and a
about blood
concussion
pressure.
and meningitis, then it was just blood pressure all along. So I suffered those 3 weeks had I just,
Check your
after
blood
that,
pressure
yeah.
and acted like a well,
maybe let's see some other things other than just going with this. So,
Wow.
yeah. So
It can happen.
I
It can
get it. And
Yeah.
being a nurse myself and in the home with people, I tend to, are you bleeding? Are you still breathing? Is there, a major issue here? Like, I'm always triaging at home on the importance of where we are.
where do we need to go from this?
Unfortunately, sometimes my poor kids, I'm like, you're fine, check
Go
it
on,
out,
get
get up,
outta
you
here.
gotta go. So that's just some people's mentality of things. And by the time we see them, had we gotten there sooner and been able to help sooner, they would have felt better way sooner than where they are. Because once you go so long with feeling bad like that, it takes longer to get back on the uphill
The different
mend
regimen
of it.
of getting changed.
In therapy, they say for every day in bed, that's what 3 days that it's going to take you to regain
to
that
get
when
that
you're
muscle mass that
when
you've
you've
lost.
been down. So it's the same thing when you go feeling bad for so long. Your mood's not good. That affects your mental state too. And once you start feeling better, you got to work on all those things. And when I said skincare, when you're feeling bad, it's not just, oh, I feel bad today. It's everything involved with feeling bad. We don't take care of ourselves as well. It's a lot of times I find myself, I've always been one that this makeup is coming off before I hit the bed at night. So that's a good example. I don't feel good today, so I'm going to bed. I wash my face in the morning, and then you wake up in the morning and you're oily and nasty.
You
and
feel worse.
Now your face is broke out next week, and so you're beating yourself up because you didn't feel good that night, so you skipped that, and now you're paying for it. And we pay for it. We pay for not, staying on top of things. I had to have my first mammogram last week
Yeah.
because I finally turned 40, and that's not pleasant. There's no part of that that's
It's not
fun.
bad like it used to be.
I mean, I don't know what it used to be. What
She
I
just
know
turned
is
that age.
it's
to be
it's
real
the whole
bad.
process.
I go next
of
month.
it, and I don't know. I probably would have put it off had I not
Had no
really
known.
just been thinking and trying to get my schedule lined up for the whole next year. I would have been like, it's okay. So, how many people go without doing that?
Oh,
and then,
a bunch.
down the road,
Go.
why didn't I just do that? So,
Yeah.
I just encourage everybody. Here we are at the beginning of a new year,
Time to start it.
2024.
I started
know,
it. You can too.
Start doing those little things to make improvements. It's not a lot that you're having to do other than go sit at the appointment and actually go and do it,
And
make
do
the
it.
time for it. But if you're like me, you also, like I said, sometimes I think to myself, I just don't want to know. Like, if I'm operating okay and doing all right, I'd rather just not know,
Wait till you get older.
yeah.
It becomes more.
Yeah,
Well,
you want to know.
And then I think, but you're cheating time with people that you may have been able to,
Have quality time with.
had better timing, spend more time with them, plan things that you thought you were always going to have the opportunity to do. So being proactive is actually going to give you back what you might have lost. So just keep that in mind for the new year because, you just don't ever know.
The good news
You
is,
really
if
don't.
you need a primary care physician, if you don't have one, we do have one.
Mm-hmm.
Andrea Heflin, she can get you in and get you scheduled pretty quick. They do a pretty thorough examination. That day I went, it was Monday I went.
Mm-hmm.
My blood pressure was up. She asked me if I had any problems. I said, no, I'm just really, you know how you get anxiety? Well, I had anxiety and my blood pressure was pretty high. But by that afternoon, it was back down to a decent number. So,
Yeah.
but, it's better to know things than get blindsided and end up in the ER.
And like diabetes, for example, everybody, you go have your yearly check or you go to an appointment and they're like, oh, your blood sugar's high. We need to monitor this. I myself, every time I was pregnant, I had gestational diabetes. And when you first hear, oh, you have diabetes, you're like, it's not that big of a deal. And then you get into it and you're like, oh, maybe this is a little bit big of a deal. But you're so used to operating with your system with high blood sugar that a lot of times you don't know the land that you're living in.
Yeah.
And so
You think it's your norm and it really
then you
isn't.
have to do this whole cost versus benefits thing
Oh,
when
Lord,
you get a diagnosis of something like that because I like to eat. If y'all haven't figured that out yet,
She barely
I like to
eats. But she barely eats.
I came from a family that sits down at a table every night. You have dinner every night.
Yeah.
That's how I grew up. And I have pretty much instilled that at my home. But that's what my family did. We ate for everything. Somebody had something good happen. Oh, we're eating. Somebody's going through a rough time. We're eating.
We'll give you
It's
comfort
Sunday
food.
afternoon. We're eating. I mean, 4th of July, we're eating. You name it, we are eating.
Well, we would be eating one meal. My mother's planning the next. So, yeah, true.
So, for somebody with like a diabetes diagnosis,
Yeah.
that's a big cost versus benefit.
Ooh,
like,
yeah.
if you are centered around, I mean,
Yeah,
I can't tell you,
eat.
normally by 2 o'clock every day, I've gotten some text message from one person in my household, what's for dinner tonight? So, I mean, it's not even what time is it?
She's already thinking what's for lunch.
And I guarantee you, I haven't had the chance to send the message out to our group yet, but I'm always like, what are we eating today?
What's for dinner?
So you get a diagnosis like diabetes, that's a huge cost versus the benefit because you look so much at this is your lifestyle, this is what you like to eat. If you're a picky eater on top of it,
No, it's
more than
bad.
likely we know you're already not eating well. I don't eat well. I had my A1C checked and it's way better than what it was, but I was highly disappointed and I went back to the doctor's office and I was like, why is it still so high? And they were like, this is a good one. I said, I've been doing all these things. Like, I expected it to be like 4. And they're like, look at what you eat. A lot of cake. A lot of cake, a lot of
I like
processed
cake.
stuff. I like
Cake's
French
good.
fries,
Cupcakes are my favorite.
chips, but that cost a lot.
Those
Somebody
healthy
who-
choices versus
yes.
the comfort foods.
That cost a lot. So we ignore it. And then we ignore it for so long that then we start having problems with our feet. Dizziness. We're sleepy all the time.
Yeah.
We're extremely thirsty. So we go from feeling pretty okay when it's managed all right, but we've started to ignore it, that then we end up having
just
to do a
gets
whole
way
lot
out
of
of
things
control.
that's not fun. I mean, I don't mind telling you, I ended up pregnant, big fat pregnant, doing a sliding scale with insulin. So that means I was giving myself a shot 3 times a day for after meals. And that's poking my finger 3 times a day after a meal. That plus long-acting insulin in the morning and long-acting at night.
Woo.
And that's still not managing like your blood sugars where you really want them to be. And I had a whole child growing inside me. So I get it. It's hard.
very hard.
Then I started cheating the system. I figured out, if I want pizza tonight, I'll
need to
just give
do
myself
this.
some extra insulin ahead of time and it will go fine.
But diabetes,
No.
it's a vicious disease.
It is.
It attacks all your major organs. So my mother had diabetes. My sister had. I mean, it's in my family, but it's hard to manage with today's society with fast
It
food
is.
and being able to eat the things you want to eat and still manage that your numbers.
Yeah, I mean, I cannot tell you how many times a day I have to stop and say, how much is this going to cost me? How much is this going to benefit me when it comes to your health? Now, a pair of shoes, I don't care. It's the benefit.
Girl, I like me some shoes now.
Now, shoes, clothes, I don't care the cost. This is the benefit. We
I
should
agree.
be that way with our health. You have to stop and say, what is this really costing me? And what am I, what is the benefits of it? I said a while ago I was 40.
She finally
40,
admitted.
yeah,
She hadn't
I will
admitted
admit
this until
so
just this
40
minute.
years old, pretty much managed diabetes now, pre-diabetic, high blood pressure, and a 3-year-old. So that's a lot, y'all. And I mean, come on. I the other day,
She cracks me up.
the other day I was like, oh my gosh, when he's 15, I'm not even talking about how old I'm going to be. So
You're alive. That's what matters.
Yes, I mean, I'm going to be old when he graduates.
But you're
I'm
going to be healthy.
well, we're working on the skincare, and I am going to be healthy because I have 3 older children who they're older, almost adults, and I was still in my prime, is what I thought. So before Job, when the youngest one graduated, I was going to be 42, and I'm like, I'm going to the beach. I'm still going to the beach when Job gets out, but
It'll be a
we're
little
gonna be
different version
42.
of you.
Yes, it's definitely not going to be the same bathing suit and all the fun things that I had planned, but I want to make sure I'm here for that.
You're able to
Yes,
do
so-
it with him.
And it's the same thing. If you don't have, my case, a 40-year-old, again, you may not have a 3-year-old, but you may be in the same boat where I'm at with a 21-year-old that's married and living grown-up life. It's not very many years till I know that they will have a baby.
Wait. I'm just going to ask the question. What if they have a baby?
Yeah. So, I mean, and I have, we're praying about that. But
She doesn't want to be called grown-up.
no, but you want to be able to enjoy. So where you are, start early and not younger.
But that's your legacy.
Yes,
That's the way you have to look at it. It's
yes.
your legacy that's
And
going
that's
to
really,
continue after you're
truly-
gone.
That's all you leave behind is
It's your legacy.
So
What legacy will you have?
Yep, it is. And so normally we're geared at home health and, hospice people, but a lot of people are watching this that are not home health or
Yeah.
hospice. I mean, I'm even at 40, I could use home health if something happened, but
There's been a couple times I need them.
yeah, I mean,
lie.
it could happen.
My back goes out, whatever the case may be.
But trying to stay active where you are now, and I don't exercise, I'm just saying trying to be proactive at the beginning of the year, set your goals on that and look to, not just what I'm doing in 6 months. I'm trying to get to the beach and be living my best life looking good. No, I'm trying to be there for a graduation, a grandchild, things like
Longevity.
that. So, yeah. And you want to, like your legacy, when you're talking about it, you want your legacy to be
Continue on.
you do. You want people to remember you for being a good person, for, your kindness, your love, but you also want people to say, she encouraged me to do better. So, and that's, with what we do every day.
Oh, yeah. We see that.
When I leave my house every morning, like the last thing I say is just, Lord, put somebody in my place today that needs help. That's what we're
Let me
here
help
for.
and guide.
Just put us
Yeah.
here, let us help somebody. So, look at your 2024 as
a time to
being proactive.
To take care of your body, to take care of your health, and look at that legacy that you're going to be leaving, that you're teaching others to do so. Like I said, I went and saw my doctor this week and making some changes. So, yeah.
And like with perfect example having you here today. If you don't know how to be active about something, proactive, Regina coming into somebody's home, how do I get this for my loved one? How do I do this for my loved one? This is your advocate. And I know last week when I said she was coming, every time I sit down and have a conversation with somebody and I say, and you get a social worker, it's always this mixed look of,
what? What does that mean?
because your goal is never to remove somebody from the home or cause a problem. And I know a lot of times, if you don't really know what a social worker does, your first thought is, I'm not telling them nosy people nothing. They're not getting it out of me. So, but to know you
What they
have
do.
somebody to help you be proactive. You have somebody to advocate for your family member. You don't have the answers. You have a phone number. You have an advocate for you. With Retreat, I say we're all advocates. We all carry fiery personalities when it comes to people's personal care. You may see me out somewhere and I'm not one of those that would, if somebody's going to be rude to me or something, I'm normally like, you're having a bad day. I'm not confrontational. you involve somebody's care, and that's a quick way to get me fired up. And you have a whole team full of people that are, have huge hearts ready to take care of people. We sit in these meetings on Tuesdays and Wednesday mornings, and I'm pretty sure that we would have Ricky feeding all of Bowie County.
Yeah, we have to, because as soon as we bring it up, he goes, okay. I'm like,
I mean, and he's just always like, well, we're just figured out, we'll do what we can do. So, having somebody to be proactive and call for you, to give you the numbers to call, or, say, hey, we may not have the answer right now, but this is what I do, and I'll get it for you.
So some of the things that you do, I mean, you have a plethora of resources out there, from, not just funeral homes, but, pantries, to name some of the things we might not know that you are helping people with.
So utility assistance, during the COVID, they had the rental assistance.
Yeah.
They had the Texas Core that was paying electric bills and water bills, which all the money is gone now.
Yeah.
Even helping on the Arkansas side. Because even though we do have some patients that live on the Texas side, they may be living with their family.
They needed to relocate for the time being. Yeah.
So there are services. Their area agency on the Arkansas side helps out a lot. Helping with Medicaid applications, food stamp applications. Helping with finding insurance. The Artex Council will actually sit down with you and go over different Medicare plans and enroll you in those plans, because Medicare is very confusing.
It's overwhelming,
and they're scamming.
I had somebody call me last night about Medicare
they're doing a lot
issues.
Of scamming with our elderly people.
Oh Lord, don't get me. I was on that bandwagon last week. I stepped up there and I was
Well,
mad.
they just wait for somebody to say yes.
If they have it on a recording that you agreed, whether you agreed to it or not.
The late night, commercials at 3:00. You can get dental, transportation, all this stuff for $20 a month. And, with them being on fixed incomes, they're like, oh, I need this. And then they get them in it, and then they don't know how to get out. There are ways to get out of those programs, the Medicare programs. If you were enrolled and you thought that you were going to get this, you can get out.
Absolutely.
You don't have to wait to open enrollment.
You do. It is a monthly, because it's federal. So if you sign up on January 1st and you get to the end of January and you're like, oh, this is not for me, cancel it before that month's over, and that you go back to traditional Medicare the following month. So it is a monthly in and out.
Yes.
I mean, you can't do it all the time, but if you're getting those phone calls and they convince you to do it, and then you don't see the benefit in it, like if you're in the hospital and it's acute care. Again, that's one of my biggest pet peeves, is your managed care is not going to give you the time that you necessarily need. Medicare will. So that's just, if you're in the community, it might be a great. I mean, I said my husband was on Humana, and it's been working great for him.
Yeah.
But
you do like incontinence supplies too. Like you're able to help people get incontinence supplies.
Yes, that's through the Artex Council. They do a big old box of, Chucks, incontinence supplies, a one-time supply. They do the emergency response, grab bars, different things in the home.
How long does it normally take when you're needing like grab bars, things like that, to be put in the home? Is it like a waiting list when you go through them?
Normally I just go ahead and make the referral, send it over, and they immediately call them within the next couple of days. They're very good at calling patients when I make referrals and setting it up with the families and getting services done.
And that's a one-time thing that they'll come out and do that for look at your bathroom, see what accessibility. What about ramps, things like that?
They do that, and there's also a organization here, the Texas Ramp Project, that does free ramps. It's actually a group of volunteers that do it, and they supply the supplies, and they go out and build the ramps. For family
I did not know that. Okay.
Yeah.
I mean, there's some great things that you have just tucked away in your little bag that you carry.
Bag.
More than likely, if they tell me, I can probably more than likely
dig and find
I
it.
might know it, I'm sure, but it's just all about researching. I'm always researching.
That's good.
Trying to
that's that one
stay
over there.
I do that too.
She just educates me daily.
Yeah.
So tell me one of your toughest cases you ever had that you feel like was a success story for you? That you went in there and it was, whoo, Lord, help these people. I know, I'm really putting you, hey, that's what we do. That's what we do.
A tough success story. I mean, I can't think of one.
Okay. I know you've had them.
Yeah. Well, I would say, the one that we recently had here with one of our patients.
Okay.
Where we had APS involved.
Oh, yeah.
Lady was just not living in good conditions. Family was to take care of her. I felt like as a team, we really were able to get in there and help this lady because even her family weren't helping her. Mm-hmm. And with us going out there and seeing these different things, we were able to get in there, get her out, get her to a safe place. And so now she's in a safe home. She's being taken care of mentally, physically. She's eating. She's doing
thriving.
well. She's thriving. Had we left her there or nothing had been done, she probably would have, died.
The thing about working for Retreat Healthcare Services is the owner. The owner, he jumps in.
Mm-hmm.
And this case that she's talking about, he jumped in and was able to make changes to help her and get her into a safe environment, which, a lot of companies don't invest that. Mm-hmm. And I can speak from experience because I've worked for many. And that's something that's a breath of fresh air. That you go and talk to him, and if there's a need, he's like, okay, let's do it.
Mm-hmm. And this ain't the first time,
No, there's been many
presented, hey, this family needs this, when a family needs bills paid, I can always reach out to the team and be like, hey, can we raise this amount of money so we can pay their bill, and everybody is jumping on board, willing to help, our owner even steps in and does things.
He has moved somebody in to an
How many
apartment,
people have moved in free?
Yeah, help find an apartment, help get the
buy furniture, get their
food,
utilities
shower
on.
curtains, toilet paper, you name it. Like
Y'all,
a fully furnished apartment
unheard of.
to get somebody into, just because they were not in a good environment. So it is a very fierce group, is the best way to put it.
This morning you were just saying somebody needed clothes and everybody's jumping in and getting clothes.
Mm-hmm.
That's where it feels good. That's the part that I love is we're a team that pulls together and helps people. It's not just because we got you on admission or you're now in hospice or home health that we've done our part. No, there's so much more to it, and I like that.
Well, and even the fact that if you are on Retreat Healthcare Services, home health, palliative care, hospice, at some point or another, you're going to have to call after hours.
Yeah.
When you call Retreat after hours, you may initially get a recording that says that the office is closed, but if you need to speak with someone right now,
push this number.
You have a 1, 2, or 3, home health, hospice, or transportation. 1 or 2, you're going to get Ricky directly on the phone when you're calling. So you're not getting a call center somewhere across the United States and I'm not saying anything bad about it. Prior companies I've worked with, there are RNs that are answering the phone across the nation. Yeah. You're getting local. The owner of a company who's going to make sure that his people that are under the umbrella of Retreat are getting exactly what they need. It's not being passed off or put off. He's actually the one making sure things are, a visit's being made of. What can we do? Mm-hmm. So,
and the thing is, this is not a small company.
No.
It is, and I wonder when he sleeps. I really do.
Mm-hmm.
He's always going. And he knows the patients and he knows what's going on with them. And I can't remember what I did yesterday. Some days I have to make notes.
Even the admission process.
Yeah.
If we know somebody's coming into the inpatient hospice unit, he's going to make every effort
to come in,
to be there himself when they come through the doors, to tuck them in and make sure that their expectations and how it works and what questions they have, and he's there every day pretty much. At any point in time, he will sit back down and have another conversation with somebody or work with somebody till we can figure out a good discharge plan. So you just don't find that anywhere else.
This is the administrator that I saw in a polo shirt and scrub pants. I didn't even know who he was. I was in the building at the desk talking to the nurses, and somebody came and did like that. And I'm looking around, and he was pushing a housekeeping cart. And I said, "What are you doing? He was like, well, I gotta help out, housekeeper. We're down a housekeeper. And I've seen him, on the floor, just doing different things. So that's what really made me look at, retreat and just the administrator, because if he can get out there and work and fill in when they're short, I have a lot of respect
Hang
for him.
TVs.
Yeah.
Well, he goes to
He's
homes
gone
and
in-
helps put up beds. I
Move
mean,
furniture, hang TVs,
He
but
does.
that's amazing
Yep.
because, he doesn't ask you to do anything that he wouldn't do himself.
right.
So if he does ask you something, he's probably already done it.
Right.
So, which is a breath of fresh air again in our community. You don't see that every day.
So I do need to give everybody a reminder. Today's the 10th. So you men, you got 4 weeks. Valentine's Day's rolling up.
Oh, Lord.
Oh, yeah.
High expectations. Most women carry very high
Very high.
expectations. We say we don't, but
We need to have
we do.
somebody on
We
here
really
that's a
do.
male because they don't.
So
feel that way.
start thinking about it now.
you
back to
gonna
being
make sure
proactive.
you want to go ahead and give your list now, so
Not,
Eric can
yeah,
watch it.
being proactive. That's giving you 4 weeks. I mean, it is 4 weeks.
Yeah.
Valentine's Day's 14th. Today's the 10th. So,
I would like a hot tub, Gerard.
yep, you better
Because you needed to know.
start kicking those ideas around and order it now. Go ahead and order it if you're an online shopper, so you know you got it and it's taken care of.
It's a done deal.
Or cash is always.
It
Oh,
is
yeah.
a great option.
Yep,
Yeah.
cash is good. You need some suggestions. Any one of us can
Hook
help
us,
you
you
with
just
that.
give us a call.
Yep.
We'll let you know.
So, but yeah, 4 weeks. So, 'tis the season upon us for King Cake and Love. So,
Oh, we'll be at the Mardi Gras.
yeah,
When
we
is that
will be.
again?
It's
When is the
February
Mardi Gras?
10th, so it's exactly 1 month.
We will have a float.
We'll have a float at the Mardi Gras parade downtown. It'll be a lot of fun. It's going to be at night this
Yeah.
year at 6 o'clock. We're going to try to have as many as the retreat crew there that we can have, and we'll have some fun things to throw. And it's just always a good time. I like to go every year, but
This will be my first one.
yeah,
Here.
It'll be my
Here.
first. Yeah.
yeah. It's previously it's been during the day, so this will be the first one they've done at night, and I think they have a lot of things lined up downtown
Tell you
for
what,
people
downtown
to come and
Texarkana.
do. So
It's getting good.
yeah, and I noticed that when we did the Christmas parade right in front of Cross Ties, the lights,
Across
how
the
pretty
street.
it was, and
Yeah,
I just
lit
saw an article that's going to continue. Like they're trying
Year
to
round.
get all that done down there. So that's exciting. That's really pretty. It's a little bit like a Hallmark movie at Christmas time. When I
Oh,
was
yeah.
looking through there, I was like, oh, if we had a little snow and
Coming Monday.
Snowblower.
yeah.
So apparently there's going to be bad weather coming Sunday evening, Monday, Tuesday. Get those pipes wrapped. Check on your elderly people. Make sure there's plenty of water, food in the home. Don't everybody run to Walmart today, though, okay?
Yeah.
Well, they gonna
Not
run
today.
to Walmart the day before.
That is. Well,
Mm-hmm.
and I think it becomes like even when the snow's coming, they're like, we're going to go get bread. You got 10 loaves in there. You need more?
Yeah.
I'm just,
And I don't even know where that comes from. I've
Panic.
always asked that question. Why do people go get
bread,
bread, eggs,
milk.
and milk?
Yeah.
What are you making with bread, eggs, and milk?
Well,
Well,
it's
you
your
can do
it's your
a lot.
foundation.
Yeah,
it's
you
your
can-
foundation.
You can
Yeah.
make a lot, scrambled eggs. You can do sandwiches.
Toast.
What,
French
you
bread.
making an egg sandwich?
Cereal.
Egg sandwich.
You
If you run out of
Uh,
anything else, you can survive on that for a little while.
Yeah.
Maybe.
I know when we had the ice storm, was it 2000?
Like
It was
2021, 20.
No, two.
No, it was
way back. It was
2000.
way back. 2002, maybe.
Well, we just had another one.
It wasn't
Remember?
2000.
No, this
2002.
was the ice storm that took out the town.
For 2 weeks. It
Oh,
started
okay.
on
Yeah, yeah.
Christmas night. It started with black ice. Is
It
what
did,
happened.
it
had
did.
been raining and then it got cold
Oh,
and
I
everything
remember that.
froze.
Oh Lord, we
Yeah.
lived in an all-electric home, so we moved out real quick and moved in with my parents, and that was fun. Going back to them as a grown-up with a child. And when we finally got electricity, my parents started crying because they didn't want us to leave. I'm like, oh Lord, we're getting out of here.
Yeah.
But
We
they had a
ate good.
generator, heat, and all
Yeah,
that.
we ate good. We had a generator.
My dad went to
actually
the-
barbecue.
My dad went to the store every day to get eggs and milk.
Well, that's why I said we ate good because we just cleaned out the deep freezer. So there was all kinds of things that we barbecued and ate.
It was still frozen though. I mean, So, and then the snowstorm we had
Yeah, back in
2020.
It was 20 because it was the year I
20.
had Job. I remember I had Job December 3rd. I went back to work, I think February 2nd. And then by the 10th, it was in my memories this morning, his first snow. So it
Because that was
started
what,
then.
like 2 weeks of.
Mm-hmm.
It was.
Yeah.
I didn't think it was
That
ever
was
going
at
to stop
Christmas,
snowing.
yeah.
I thought it was so pretty at first, and by the second day, I'm like, okay, it can stop.
Yep.
We went to the grocery store one night, and my husband, he didn't want to drive it, so I drove. The windshields are freezing up, the windshield wipers. I'm like, oh, we're gonna get stranded out here, and I'm like, ooh.
It was some good snow though.
It
I
was.
like snow.
It was. I love
It was.
snow, but not
I
continuous.
don't want to drive in it. Somebody's gonna have to pick me up.
Well, now when I work for Kindred, I do have to say, you know, because I would work for home health, and you have days that you have to see patients, and if you don't, you know. So me being me, I volunteered to take the nurse out. It worked out. Nobody died.
Well,
Nobody
no,
died.
nobody died.
And we didn't run off the road. I do remember going down, it was in Arkansas, down this one, it was 2-lane highway, but only one was open. And we're going across this bridge, and this truck's coming. I'm like, but it's on my side that's open, so I'm going to need you to stop. It was bad. But we made it through. I didn't get stuck in anybody's yard. And the little nurse I was taking was 4 foot nothing. She jumped out one time, and it went to her waist. And I go, you good? Do I need to get out? But I took her from all the way almost to Fouke to Hope, Arkansas. So, and my husband goes, you've lost your mind. I said, hey, my car has snow on it. It must work. So, yeah.
Anyway, well,
Well, we're glad you came today. It wasn't too painful,
Well,
was it?
thank you. No, it wasn't.
How many patients you got to see today?
I don't know. See, the thing is, it's more paperwork, calling, following up, than it is seeing patients.
Going seeing them. Okay.
and then the last minute people that they throw on you.
Well, that's fine.
The people like
that's-
us that call and go, could
that's
you go
okay.
help them?
I would rather make sure that their services are in place and they're getting what they need, and following up, because you know, if I tell them I'm gonna do something, I try to
You follow
try
through,
to, yeah.
which is a good thing. It's a good thing.
That's how you build rapport.
Correct. That is correct. Well, this was Wellness Wednesday with Deborah and Rachel and Regina. You know, think about those plans of getting healthier this year. It's a great time. Go see your PCP. If you don't have one, we can get you hooked up with Andre Health Fund really quick. Just give us a call at Retreat Healthcare Services. Ask for myself or Rachel or even Regina. She can help you.
Yeah.
And see what
We just
can.
volunteer out for
Yeah,
everything.
you know.
You need any social services issues?
We can get you her cell phone.
yes.
Press 9.
We said we were going to put the numbers at the bottom. We haven't done that yet. You know, our goal is, even if you don't come with Retreat Healthcare Services, to make sure you are with who you need to be with, and whatever's going on in your life, to help you with that. I think we need to have a chaplain on here next time.
Yep, that was my next thought. I think we
Y'all
need
get
to.
Father Augustine.
Ooh, Lord. You know, Augustine would be a great one. I don't know if we have enough video for Augustine.
Yeah,
though.
well, that is
If he
true.
gets going, he gets going.
Yep.
Either him or Pastor Ross.
Yeah.
Maybe we have them all. We'll have all of them on
Holy
together.
Wednesday.
Yeah, Holy Wednesday.
I'm telling you, you know, you don't judge a book by a cover. And I've worked for other hospitals. And I met Augustine. I actually worked at Christian Care Center. He came in, and somebody goes, "Oh, there's Augustine." I go, "Oh, who's he here to see? Is his mom here or dad?" They go, "No, he's a chaplain." I said, "For where?" I did. I said, "For where?" And Augustine, again, do not judge a book by its cover. Man is full of God. He's got the Holy Spirit in him. He had overalls on, a straw hat. His overalls were tucked in his boots, and I was like, "Okay."
Isn't that what he normally wears every day?
Pretty much. I saw him dressed up one time. I was like, "Oh."
Yeah, the Christmas party. He was sure.
But to speak with him, it'll brighten your day. So again, don't judge a book by the cover.
Yep.
It's fun. And he speaks Spanish. I didn't know that until he was talking in our building one day. I was like, "What?"
Really?
So you know, we're well rounded. We have the umbrella that Rachel likes to say. We have a little bit of everything, from home health, palliative, hospice, non-emergency transfer, infusion in the home. So yeah. Even get you a physician.
Yep.
So
And a volunteer coordinator.
and we do have that too. I forget about that.
A volunteer.
And chaplains, and it's a multitude of things. And there's a lot of people in the background that do a lot of stuff that make it run so smoothly. That we just kind of, I'll come in and go, "Can you help me with this? What do I do with this? What's going on?" And there's people back here that helps us with that.
And our goal is to get you introduced to everybody, so you get faces with people. If you have to call the office, you kind of have a face with who you're talking to, or who you can expect to come. But there's lots of exciting things coming this way in 2024, and we're just happy to have everybody with us, and look forward to serving needs in the
What's
area.
going to come
And, yeah,
next?
you just never know with us. Never know. But
Have a blessed Wednesday.
yep. Bye.
Bye.
Choose excellence in healthcare. Choose Retreat Healthcare Services.